I am Dr. Sridhar K. I am consultant neonatologist and a consultant pediatrician. I am head of the department at Zuleika Hospital at Dubai. And we have been seeing some mothers with COVID positive coming in, but luckily the newborns have not been significantly affected, even if they are born to a COVID positive mother, and very few babies have any symptoms at all, and we don't do anything different compared to normal babies except for the wearing PPE and taking the precautions, and the parents understand the situation. They're not overly alarmed or anything, so it's been helping us as well. But as time goes on, I think this will continue for some more time, the crisis, and we will see more cases. Possibly we might start seeing babies presenting with a viral chest infection and things like that. Previously we used to have RSV infection caused bronchiolitis, and possibly we might see chest infection similar to that with COVID as well. So only time will tell, but obviously as far as babies and children are concerned, there is nothing to be overly concerned. And recently you might be reading in the press about the inflammatory syndrome in children related to COVID-19. So we used to have a condition called Kawasaki disease, which presents with multiple system involvement. So you may have even coronary dilatation in the heart, and we give immunoglobulin therapy to reduce the severity of that problem. And there are reports that this COVID-19 infection may produce a symptom, but that is more in the older kids, not in the babies. The main concern that parents have is regarding vaccination and whether their routine vaccine should be given as scheduled. And now that we are past the lockdown stage, it's not advisable to keep delaying your routine vaccinations. Obviously, you can discuss the individual situation with your doctor, and if it is okay to wait a couple of weeks or a month, it's fine. But there are important vaccines in the first year of life, and at the 1 year stage, the MMR, mumps, measles, rubella. The measles is also a serious infection, so we have to make sure that we are not delaying these too much. Another common concern that they have is whether the growth of the child is going normally, and that is a concern we commonly address when they come to the clinic, but now they are not coming to the clinic. So they should remember that healthy children have a different growth pattern. Each child is different, so you cannot exactly say my child has to be at this weight range or they should be chubby. There are a lot of factors. There may be genetic factors, there may be the birth weight. If your baby was premature or was growth restricted, they may not grow at the same rate. They may have a lower potential. Your family may have smaller people, and genetically your baby may have taken that aspect. And obviously if the baby had any other issues which may affect growth, you should be aware of that. We do have growth charts, and now we have good apps to monitor growth, and you just have to select to plot the baby's growth in the WHO or World Health Organization growth chart in the first 2 years, and after that you can use the CDC charts. So the WHO charts are designed for breastfeeding babies, and if you go by the age of the baby, and if you have earlier weights, you can record them and plot them as well. So that will give you a percentile distribution for your baby's growth. And by percentile, we mean where your baby's growth falls in relation to 100 children of that age. Suppose your baby is 6 months old, it's a boy, and the child's weight is 8 kilos. That's likely to fall in the average, which is close to the 50th percentile. But we take, as pediatricians, we take anywhere from the 10th percentile to the 90th percentile as normal. So you don't need to be bang on the middle, because you have a range. And then once your child falls on a certain percentile, we expect them to maintain it. If it is dropping rapidly, there may be factors to explain that. Again, you have to discuss with your doctor, but don't be unduly concerned. If the child's weight is going excessively nowadays, with more TV time and games on the TV and things like that, obesity is likely a risk as well. So you should watch the trend and hold the reins when you can. Avoid unnecessary eating, avoid junk food. So it's not just poor growth we are concerned about. And if at all you had started any high energy milk, remember that it is for a short period of time to boost the growth. So try to avoid continuing it, especially if the child's growth suggests that they are gaining weight too rapidly. So in terms of growth concerns, my advice would be that individualize your child's growth pattern, know where your child is on the growth chart, and follow that trend. Reducing activity leads to more screen time. So both for reducing screen time, which is harmful for the child's development, and to avoid obesity and to keep a general level of fitness, you do need to focus on activity. And children do look at the parents as their role models. So we have to give them the example. We have to stop screen time ourselves as best as we can. do your essential stuff, but don't let it interfere in your interaction with the child. And physical activity, try to do it with the child. I mean, go out to the park with the child, run around with them, kick the ball. If they have a bike, take it along with you. So, I mean, encourage. Nowadays, we are not that much encouraging adventurous activities. And when we were kids, we used to jump up and down. Parents didn't stop us. But now we are worried about injury, probably rightly so to an extent. But we are curbing their adventurous spirit, the freedom that they face. So, playing with other children nowadays may be a little difficult with the social distancing, but we have to find the balance. So, I mean, don't go to open play areas where there are play gyms and things like that, where you'll come in contact with many other children touching same things. But if you're in an open space kicking a ball, it's perfectly safe. The swimming pools may take some time to open because there is a risk from there, but the normal activities, walking, cycling, kicking a ball, running, these things should be okay. And I see that tennis courts are starting to open up as well. So sports like that where you have minimal, I mean, you may have to wash your hands after you play, and you avoid touching your face while you're playing. So these things might need to be monitored. But apart from that, if you don't have any elderly person in your family, the risk to your own family is not very high. But if you have some elders, you have to be extra cautious. The children are not the high risk group, the healthy adults are not the high risk group. But if you have obese individuals, if you have people at high risk in the family, you have to be extra careful.